I've been asked to demonstrate a couple of things that we can do to help upper back tension from desk posture problems. A lot of people are now working at different desk heights with having to work at home. So, you know, you might be working on your kitchen table, your dining table, or little stools or something. So our backs are not used to this. Now, one problem that we would normally have is, if I show you here, sitting at a desk, you tend to create, over time, you tend to go into a slump. So you'll see the shoulders drawn forward and then the chin goes out like that, and you get this horrid posture. We're all tight here and we're overstretched at the back. And what we really need to work on is getting you up, back and chin in, so that we get a nice alignment there. But that's easier said than done. So we need to think of, when we tend to experience tension here commonly with desk posture, we need to think of it in a sort of a more holistic way of looking at the body. Rather than just constantly rubbing it, putting heat on, we need to actually start to look at the upper back and think of the muscles and how they work as a team. Muscles don't work on their own, they always work together as a team. We would call this the agonist muscle and an antagonist muscle. You can always think of it like the mafia. We used to look at it like that, where there's always one that might be a little bit tighter, so the others have to do a little bit of an extra job. Everyone's always working together. So for the upper back, problems here, as your shoulder blades are drawn forward to get to your keyboard like that, the muscles here are overstretched and they will always constantly be trying to pull your shoulder blade back. But they can't pull that back until this pec muscle here that has become tightened and shortened, because it's constantly in this position here, we need to release this pec to allow the shoulders to come back. So we've got to look at it as this approach where we're looking holistically at the body. And this approach can be applied for anything. So right down opposite end of the body, shin splints, for instance, we would possibly treat the calf in order to get the shin splints better. So it's just a good overall way of looking at the body. A couple of things that we can do to help. We do the desk neck stretching routine that is on another video. We'll also now show you now a stretch to do for the pecs here. So what you do is you get yourself a door frame. I'll just wheel this out of the way. So, door frame. Put your hand against the door frame at 90-degree angle here. So if I've got my right hand here, I'm going to stretch forward with your left, so your opposite leg. So, and you just stretch forward until you feel a stretch here, and it's a really good pull. You want to make sure that your hips are straight and parallel. They're not leaning forward at an angle at all. You're straight on, and you will instantly be able to feel a pull, and it feels amazing. Hold it there for 10 seconds, and you can do that a couple of times throughout the day, and it's really, really, really can't stress that enough. It's really effective at allowing these pecs to loosen off and allow the shoulders to get back, and then as a consequence to that, you then get less pain here. So that's one thing. The neck stretches in the other video. The other thing that you can do, especially if you have got mid-back tension around bra level, is you need to sit down like this. So if you sit down, arms straight out, and you're just going to slide horizontal. I call this Superman. So like that. You'll feel it around your ribs. It's just rotating the spine like that, and it's getting a bit of movement into that spine at this junction. Really effective for that type of area. So those three things, we're off.